Hello, dear colleagues. My name is Susanne Raeburn, and I would like to say hello to everybody here from Zurich. And I am so delighted that I am able to speak to you on the 9th Emirates UCG edition on conference on nursing and patient safety, which will take part from the 6th to the 8th of April in 2021 online. My topic, where I'm coming from, I have been training as a nurse many years ago, and I have been working in intensive care units. I have been doing work as a nurse manager, as a nursing director, not only in Switzerland, but also internationally and abroad. And one thing that I always missed is that I did not have appropriate KPIs that I could really have a case that I could actually argue in front of a CEO when it came to nursing staffing levels, when it came to actually measure the outcome, when I was able to contribute, especially to taxation issues. This was all, or in many cases still is, something that comes out of a gut feeling, and we lack really the evidence there for what we have. Many years ago, about 10 years ago, I joined here in Switzerland the LEP company, which is very much specialized in providing these kind of KPIs in terms of a standardized nursing language, which also provides these kinds of outcome measurements, for instance, and is introduced in all different kind of software clinical information systems, meaning that I can have my documentation of my workload of whatever I am doing in nursing, starting from giving a bed bath to the patient, in administrating any kind of drugs, taking blood pressure, or whatever it is, in any kind of settings. Might it be ICU, might it be in the care for the elderly, but what I can do is really document what I am doing. And the trick in all this, in this kind of standardized language, what we use, or terminology, if you prefer to say, is that we can also combine this with a evidence-based amount of time. So at the end of the day, I know very precise how much time I actually spent in caring for this particular patient. Now, this also then, of course, at the end of a procedure, the end of a nursing day, then can tell me how intensive a patient was, or how intensive his patient care was, not only in terms of time, but also for nursing scientists. It's very interesting to see, are any kind of nursing standards actually adhered to, or what is actually the outcome of this kind of treatment? How many informational talks have been given to the patient, or how many treatments did he have, also in terms of any kind of KPIs with regards to SNOMED or any other standardized nursing language or nursing diagnosis as NANDA International, ICF, or ICNP, so we can actually combine this all in one particular tool. In my talk, what I would like to actually show you then, between the 6th and the 8th of April on our online conference, I would actually like to show you how this is implemented on a practice basis. So I'm going to show you how the nurses are actually documenting their daily work, which also, as you all know, at the moment with this increase in administrational work, is very different because we see so many stakeholders having an interest in what we nursing actually record. And also in terms of patient safety, we often ask the patient the same questions over and over again. And maybe it depends on what angle we're coming from, the answers can be fairly different to the same answer. So our approach in all this is collect once and use many, which actually shortens the administrational time, but increases at the end the outcome in many ways. Like I said, I am documenting once whatever I'm doing, and whoever has an interest in my data can easily take it from any kind of clinical information system as you may use in your hospital, in your nursing environment. So this is implemented in the especially German and Francophone area of Europe. We are the market leader in all this. And as a director of the global side of our company, implementing this nursing classification, I am very, very proud to be able to show you what we are actually doing and what we can do for you. So I am very much so delighted to invite you once again to the conference, the online conference from the 9th Emirates UCG edition on patient and nursing safety in April 6 to 8. Thank you very much, and I'm looking forward to seeing you all.